By the end of this week, the Department of Health and Human Services will have delivered $30 billion to U.S. hospitals. That is a fraction of the $100 billion earmarked on the federal coronavirus package. President Trump explained how the rest of that money will be distributed during a meeting with healthcare execs.
Soon, HHS will distribute additional funds from the remaining $70 billion provided in the CARES Act, a big deal to get that passed. A significant amount of this money will go to the hospitals and hotspots, while a portion of it will reimburse hospitals for the cost of treating uninsured patients and for the coronavirus.
But an NBC analysis found that so far, hospitals in some major hotspots are being shortchanged. NBC News political reporter Josh Lederman is behind that investigation, and he's here with me now. Josh, what did you find?
Well, you would think, Allison, that this money would have been doled out to the states that need it most. We've been hearing about New York, New Jersey, California, the states with all of these cases. But here's what happened. The government wanted to get some of this money out the door as soon as humanly possible to hospitals and doctors that need it. And so they used the best source of information they already had on hand, which turned out to be Medicare spending rates from last year. So this first $30 billion tranche went out based on how much each hospital or doctor got in Medicare billings last year, unrelated to COVID. And so as a result, we're seeing major discrepancies, such as West Virginia, with just 702 cases, hasn't been particularly hard hit so far by coronavirus. They got what amounts to $351,000 for every case they have in the state. Now, just across the Potomac River in Maryland, they have 10,000 cases, a much larger number. And as a result, if you look at how much they got per patient, it turns out to be only about $74,000. We're seeing this play out really in all parts of the country, such as Louisiana, another state we've been talking about, that hot spot in New Orleans and other places in Louisiana. They've got almost 22,000 cases in Louisiana, got about $21,600. If you take how much Louisiana got and you divide it by how many cases they have, just over the state border in Arkansas, they've only got 1,500 cases. They got $209,000 for each one of those cases. And we've really been seeing some concerns expressed by officials, especially in New York and New Jersey, some of the hardest hit states in this pandemic so far. New York, for example, with its 203,000 plus cases, only got about $9,000 for each one of those cases they're dealing with, while just over the state border in New Jersey, where they've got 71,000 cases, they got just under $13,000 for each one of those positive coronavirus cases in the state.
Josh, I know you also found that some hospitals got next to nothing. Who's being left out here?
Well, if you think about it, Allison, who gets Medicare money and who typically bills to Medicare, there are certain groups that just don't, such as children's hospitals, because there are almost no children in the U.S., obviously, who are on Medicare in the United States. Also, obstetricians who don't have a ton of clients who are of Medicare age also got left out of this. And then rural areas and those that have more people on Medicaid, which is for low-income Americans, they've got less people on Medicare. So proportionally, they got far less than states that have larger numbers of Medicare recipients.
Josh, you mentioned, the New York and New Jersey not getting what they need. A group of 36 bipartisan lawmakers in those two hardest hit states wrote a letter to Congress. What are they asking for, and what are they saying that needs to happen here?
Well, really, they're interested in two things, Allison. First of all, they want the rest of this money as it's being doled out, the $70 billion that's left. They want that to be apportioned more according to where there is the coronavirus need. And we've heard that echoed by Senator Chris Van Hollen of Maryland, who wants the same for Maryland and other places. But specifically in the New York, New Jersey area, they also want a separate $45 billion fund that Congress should create, in their view, in order to deal with the real onslaught of cases and all the expenses that come with it that are being incurred right now by New York and New Jersey as they try to make their way through this pandemic.
Josh, unbelievable numbers there. I know a lot of hospitals could use much more help than they're getting. Thanks so much for running us through what you found.
Thanks, Allison.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.